I'm Teun Teunis. I'm a surgical resident. I did my PhD thesis research at the Massachusetts General Hospital and the Harvard Medical School. And my promoter, David Rain, he's a hand and upper extremity surgeon, and he's also very interested in the psychological aspects of both patient behavior, but also surgical decision making. And research to date showed that there's a big variation in what surgeons decide on, even if the patient is exactly the same. So depending on the surgeon you'll visit, you might get a different treatment recommendation. And we are interested why that is. It might be, so in this case we imagine it's the same patient, so now we're looking at the surgeon side of the decision making, and it might be due to personal characteristics. Previous research linked personal characteristics to even to readmission rates, so that does seem to be an influence of surgeon personality. So we set out to measure surgeon personality and relate that to their decision to operate or not, and their confidence in treatment. And that's actually what the study is about. So we got in touch with you guys, because you have a validated personality questionnaire, or a way of measuring work styles. But I think that's work styles is very much well, it depends on personality and training.
Right, right.
And we used that questionnaire, that survey. We gave it to a group of surgeons. We have a research group, a group of surgeons that signed up to, like, on a monthly basis, be questioned for research purposes. And about, let me look at the numbers, 270 of them participated in this study. And first they went through the questionnaire. We started off showing them cases, and they had to decide whether to do surgery or not, and how confident they were in their decision to operate. And after that, after they rated all their cases, we provided them with the work style, the Octogram work style test. And they completed that, and then we related whether their decision for surgery could be correlated with their work styles. And interestingly, we found that a higher Pioneer score was associated with a greater tendency to recommend surgery. So first of all, that proves our idea that the recommendation for surgery is dependent on surgeon personality or work styles, and that adds to the greater body of knowledge that maybe we should be recommending, incorporating patient's values in our decision making, not as much as our own personality. Yeah, exactly. So we corrected for other variables like age, or where your practice is located in North America, Europe, Asia, South America. We correct for all that, and we had a bunch of cases. So we had 15 cases, and we grouped them together and calculated an overall surgery score. So it's a sum of all those cases. It's not just one case that you recommend surgery for. I think it gives a better overview of the whole spectrum.
So more of a tendency. You're looking at tendency.
Exactly. We're looking at tendencies. And indeed, a higher Pioneer score, so the Explorer kind, had a higher tendency to recommend surgery. And our theory is that people who are willing to explore or try out new things, they also are risk takers.
Yes.
They're willing to accept a little bit more risk. I mean, if you go the usual way, you're probably going to be pretty safe. And every surgery has a risk involved. Even if the surgery goes completely well, you can still get an infection or hematoma, or if you put a plate in that might need to come out. So they're willing to accept this little bit higher risk for success or for treatment, and that might be related to their higher tendency to try out new things. Yeah, because when you look at the data, I mean, sure, we found that higher pioneer score was associated with a greater tendency to operate. However, this only explained, let me look up, I got the study right here. It only explained 6.5% of the variability in the data.
Right.
You're never going to be able to predict 100%. I mean, never. But in medicine, if you can get up to 30, 40, or 50, you're doing well. So there are definitely other factors that are associated with the tendency to operate. So this is just a small but very important bit, but I see it as a starting point to look at other factors. Maybe something else than work styles, or maybe we need to incorporate their way of training. But it's always an ongoing project. It's never finished with one study. We're not judging whether surgery is right or wrong. That was not the purpose of this study. Maybe they're completely right at deciding to recommend surgery. It's just interesting that there seems to be a variation depending on the doctor you go to. So yeah, I would recommend people to try and find out a little bit more about their doctor. In all honesty, and this might be a little bit shocking, but the people I've worked with, for some you could already, you kind of know whether they're going to recommend surgery. Some surgeons have a higher tendency to say, yeah, let's operate, and others say, no, don't do it for the same patient. You know that beforehand when you work with them a little bit.
Yeah, but you have to have that experience.
Yeah, exactly. But that's very hard for a patient. I mean, you're new. You don't know the surgeon, or you know some stories about him. So it's very hard to capture such a thing. Yeah.
Wow.
And again, I'm not saying right or wrong. That's a different question. I've published some articles before, but this is a really cool one, because for me personally, a lot of studies you also do because your boss wants them. When you're just starting out, you've got no idea where to start, right? So your boss gives you a project, and you finish that. But this one, I actually thought of, at least the idea came by talking about this with a friend, and we went to David Ring, my promoter, and he said, yeah, let's work it out. And I mean, we wouldn't be able to finish this without your company willing to provide this test. So it was definitely a team effort to get this whole thing lined up. But what I like is that the whole idea, came from, started as a little thing with just a couple of researchers, and I like that. Because your software system was very well equipped for this purpose. Also, I don't think you designed it for that reason, but that worked out very well. And the science variation group, the group of surgeons we used, so they're used to doing this, so everything quickly got together, and we got it going. And then always with research, after you've analyzed it, you've written it, but then you submit it, goes through peer review. It got rejected even once, and
right.
That's how it goes. And then you go to the next journal, and they were happy to publish it. So that was great, and that went really fast actually. Once we submitted it there, we were through quite quickly. So yeah, I'm really happy about that. And what I liked is that Online Tenant Manager is focused on, their expertise is the psychology part, I think, and we're from medicine, and to combine those fields, I think that's awesome.